Good morning, everyone. Welcome to an all-new edition of On the Mark TV and Radio from Westfield Community Programming, 89.5 FM WSKB, and our media partners at Agawam Media and Southwick Community Programming. I'm your host, Mark Auerbach, and today we're going to devote an hour to a disease that is always fatal. It's very difficult for the patient and for the caregiver, and it's called ALS, or maybe you know it as Lou Gehrig's disease. I wanted to do a program about this for a long while, first of all, because my colleague, the Broadway actor Aaron Lazar, was recently diagnosed with ALS, and last June he came out with publicly with his diagnosis, and a group of Broadway people got together and recorded the song from Mana La Mancha, "The Impossible Dream," which you can find on YouTube, and is being used to raise money for ALS research. And the other reason, a member of my family, Pam, has been living with ALS since 2018. It's a debilitating disease for both the person who has it and for their family and their caregivers. But not enough is known about it. So I'm dedicating today's program to Aaron Lazar and Pam Grayboff, who are two people that I know that are living with ALS. Our first guest is from Mass General Brigham and Cooley Dickinson Hospital, Dr. Jay Levin. And he's going to explain to us a little bit about ALS, what it is, and how you live with it. Good morning, doctor.
Good morning, Mark. Thank you so much for having me. It's a real pleasure to be here, and I so appreciate you using your platform to help raise awareness.
I mean, I just from personal experience and seeing what it does to people, I can't imagine having it, number one, and number two, why more money and time has not been put into researching a way to either slow down the disease or find a cure for it. So could you explain exactly what it is?
Absolutely. So ALS, or amyotrophic lateral sclerosis, which people colloquially know as Lou Gehrig's disease after the Yankees Hall of Fame great, the Iron Horse. It's a progressive neurodegenerative disease that affects the nerve cells in the brain and the spinal cord. The nervous system has motor neurons, which are the brain cells that go from the brain to the spinal cord, and then from the spinal cord to the muscles, and then throughout the body. And that governs your ability to move all of your muscles. In ALS, these motor neurons are degenerating. They are dying off over time. And when the motor neurons degenerate and eventually die off, the brain is not able to initiate and control muscle movement. And so when folks lose voluntary muscle action, they lose the ability to speak, they have difficulty eating and swallowing, and ultimately they develop weakness and even trouble breathing and moving. So that's unfortunately the general pathway behind ALS. It's a gradual onset, and the initial symptoms can vary quite a bit. I'm not sure what Mr. Lazar's initial symptoms were, what your stepsister's initial symptoms were, but it can really start with a broad spectrum ranging from little, what we call fasciculations, which is almost as if you have the muscles twitching or quivering beneath the skin. That's often an initial symptom that people notice. Other folks notice sort of painless weakness in their arms or legs. It's for no clear reason. There's no pain, there's no traumatic injury or anything. Folks notice that it's more difficult to hold a cup or hold a pen. Or perhaps folks notice that there's just a change in their voice quality, or they have some difficulty swallowing. They're choking on liquids or on food more than they used to. And then that gradually, unfortunately, progresses at a variable rate. And then hopefully folks will get some medical attention and see their doctor, either their primary care, their general practitioner, and then from there make their way to a specialist like myself in neurology. And then we go from there. Can I speak a little bit about the epidemiology, sort of how common is ALS? One of the reasons why perhaps more research funds hasn't gone into it is because it is a relatively uncommon to rare disease. It typically starts as young as folks tragically affected in their 20s to folks tragically affected in their 70s or 80s. The average age range of onset is in the mid-50s, 55 to 60 or so, is sort of the rough ballpark. Obviously, folks like Lou Gehrig were a bit younger, Aaron Lazar a little bit younger, but there is a wide range. And folks who develop ALS, it affects roughly 2 people per 100,000. So if we figure that we have about 150,000 people in Hampshire County, a little bit more than that in the neighboring counties, we have a handful of newly diagnosed ALS patients each and every year. It's about 20% more common in men relative to women. And then the life expectancy, again, it's quite variable. Broadly speaking, the average life expectancy from symptom onset is about 3 years or so. Your stepsister, Mark, is, fighting an excellent fight and showing incredible resilience. It sounds like her disease is perhaps a little bit more slowly progressing, or through treatment or other things that we will come to in a moment, she is respectfully a little bit on the longer end of the bell-shaped curve, with the median and average being around 3 years. But again, some folks can progress a little bit faster, and other folks can progress a little bit slower. It's really somewhat difficult to predict. And the vast majority of cases of ALS are sporadic, which means that we don't know why it occurs. Only about 10% of patients with ALS have any sort of family or genetic link, which means that over 90% of folks, it's just a de novo, meaning it's just an out of the blue, frankly, bad luck situation, who gets it. And we don't exactly know why for the vast majority of cases.
When you have a patient come to you that may have it or may not, who's been referred to you by a primary care physician, it's not a primary care doctor that might diagnose it, but a neurologist or a specialist. When they come to you, it's got to be difficult for you to say, you're not going to make it, but we can help slow the process.
So I try and keep the cards close to the vest when we're discussing something as grave and as dire as ALS. When I meet patients who have been referred because of a concern for muscle weakness or fasciculations, our first step is always to do a comprehensive workup in the office, which involves sitting down with patients and or their families, loved ones, caregivers, to get sort of a thorough history. What has been the evolution of their symptoms? What are other potential confounding factors as far as, chronic neck pain or back pain or traumatic injuries or other medical causes that could potentially mimic ALS? Those are things that we would obviously want to rule out, because there would be a very different treatment plan and prognosis for those sorts of things. And then we perform a comprehensive neurological exam in the office. And then we follow that up often with a battery of blood work to exclude other potential causes, vitamin deficiencies, and things like that. We'll often get neuroimaging, which typically entails either a CAT scan, or if people are able to, we get a brain MRI and then an MRI of the neck and possibly the upper back, just looking for other structural causes that could potentially mimic things like ALS. And then one of the final steps that we would do in my clinic, for example, at Mass General Brigham at Cooley Dickinson, would be an electrical test called an EMG, or an electromyography, which involves little electrical stimulations that we administer basically to see how well are those motor nerves, those motor neurons, how well are they conducting their signals. And that is a procedure that we perform in the office. Takes an hour or two depending upon what sort of data we're getting, and that often will help to confirm or deny the diagnosis. And then it's at that point that we might have the discussion based on where patients are in their sort of suspicion and thought process as far as what may or may not be going on. So it's generally a gradual buildup as far as trying to assess what are the patient's symptoms and sort of where are they in their journey to accepting and coping with the diagnosis.
Once somebody's diagnosed, what kind of treatments can you provide, and how can you connect them with the support mechanisms that they're going to need, either with caregiving or technology to help them along?
So that's a great question. The short answer is that it's a process, and the first thing that I always recommend for my patients is just to go home with your loved ones and family and friends, just to sort of digest the potential diagnosis, to wrap your head around it, to formulate any questions or concerns that you might have when you've just sort of had this avalanche or this, dropped on your head, if you will. So go home, take some time to process. We do have time, so go home, process things, come up with a list of questions or concerns or things, and then bring those either to your follow-up visit with me. And then I always recommend, given the dire prognosis and diagnosis of ALS, that you seek a second or even a third opinion. In our case, because Cooley Dickinson is so closely aligned and affiliated with Mass General Brigham, I will often refer patients to the Healy ALS clinic at Mass General in Boston. So that is sort of the first step. The first steps are sort of coming to grips with the diagnosis and coming up with an initial game plan, and then getting a second or third confirmatory opinion at another location. So that's sort of the first step, but it's a daunting and overwhelming diagnosis. Unfortunately, there's no way that we can sugarcoat that. But again, given the geography involved between my clinic in Northampton and in Boston, we will often co-manage things where I'm sort of the local neurology resource and liaison, followed by my colleagues at the big academic tertiary care center in Boston or elsewhere. I've shared patients with Mass General Brigham, primarily in Boston, but I have also shared ALS patients with the University of Massachusetts at Worcester, with UConn at Hartford and elsewhere, based on, again, geographical preference and where patients can physically get to, given the things involved.
Yeah, we
so
should.
that's what we do there.
Yeah, I just wanted to interject one thing. For those of you here in our listening and viewing area, Cooley Dickinson Hospital is affiliated with Mass General Brigham in a variety. It's a partnership in all disciplines, and I can personally say that I have had heart surgery at Mass General Brigham, and I'm on the kidney transplant list there. And my treatment and my planning is done at Cooley Dickinson. So that means that I don't have to drive to Boston for treatment and seeing a physician. I get to see people in Northampton. And, so remember that option is available to you, not only if you're dealing with ALS, but you could be dealing with any other major disease. And Mass General is one of the top hospitals in the country. So you can have that kind of services right here in Western Massachusetts. Sorry to interrupt you there, but I wanted to throw that in.
No,
I thought it
that's
was
fantastic.
important.
Yes, absolutely. And I want to emphasize that we can do the vast majority of all of the neurology workup locally in my office at Cooley Dickinson in Northampton, but it's wonderful to have the umbrella and the connection with the big center in Boston, if need be, whether that be through Zoom or through a shuttle service, or hopping on the Mass Pike to physically go to Boston for however frequently they might need to be seen. So while folks are processing a diagnosis and sort of coming up with a game plan for things, nutrition is of the utmost importance. If folks take away nothing else from our initial appointment where ALS is potentially on the radar screen, it's to start being aggressive and straightforward with your nutrition. ALS is really an aggressive process with regard to your brain cells and your muscle tissue. So those brain cells and muscle tissue need all the calories and nutrition that they can get. So I'll tell folks, if you want to start having ice cream with your meals or nutritional protein milkshakes, whatever folks enjoy doing to try and just boost their nutrition and boost their calories is really an important first step. Folks will often ask about exercise. I think physical activity that is fun, that's engaging, and that is safe is excellent to pursue. I just counsel that folks should try and avoid physical activity at the point of like physical fatigue and exhaustion. With ALS is unfortunately not the time to sort of do weightlifting and bodybuilding because that can have a detrimental effect on the muscles, but trying to stay physically active, whether that's just enjoying leisurely walks around the neighborhood, taking the long route around a mall or a grocery store, but just trying to get out and stay active as far as aerobic endurance and physical conditioning is concerned.
Okay, we're going to take a very fast break here to acknowledge our underwriters that make this program possible. We're chatting with Dr. Jay Levin from Cooley Dickinson and Mass General Brigham. This is a program today about ALS. Peter Coles is our chief engineer. I'm Mark Auerbach, and we'll return after these messages.
Underwriting for Community Radio on WSKB is brought to you in part by Rockies. Over 30 convenient locations throughout Massachusetts, Rhode Island, New Hampshire, Connecticut, and Florida. One of the nation's largest ACE dealers. Expertise and great product selection in paint, hardware, lawn and garden. That's Rockies. Rock solid service since 1926. On the web at rockies.com.
Hi, it's Bob Plass, and I have Wow, It's Tuesday. Every Tuesday, 6 to 8. Wow, it's Tuesday.
Community Radio 89.5 WSKB.
I did
it! Live from Studio 120 at Westfield Technical Academy, this is WCPC Channel 15 and 89.5 FM WSKB Westfield.
Welcome back to On the Mark, everyone. I'm your host, Mark Auerbach. Peter Coles is our chief engineer. If you've missed a part of today's program, or you want to watch or listen to it again, or share it with friends, it's archived on YouTube under WSKB Community Radio. Our hour-long program today is devoted to a deadly disease called ALS. You may know it as Lou Gehrig's disease. It is rare, but impacts people in a lot of ways. Our guest this half hour is Dr. Jay Levin from Cooley Dickinson Hospital and Mass General Brigham, who's a neurologist who helps patients when they are diagnosed with ALS. Later on in today's program, we'll talk with a caregiver to people who have or had ALS, so you can get the other side of the coin. Dr. Levin, somebody's been diagnosed, and you've helped them. You've talked about nutrition and some of the other things. Where do they go for the other kind of help that they're going to need as their disease progresses, like wheelchairs or walkers or computer technology to help them speak? Are there organizations around that you can connect them with?
Absolutely. That's a great question. So the primary organization that comes to mind, two or three actually, but the ALS Association should probably be everyone's first stop resource. The ALS Association can connect patients and their caregivers with information regarding local resources, support groups, and so on. The ALS Association can get folks set up with transportation assistance. They have a loan bank for equipment, things like you said, like walkers, wheelchairs, hospital-style beds installed into the ground floor of a patient's house, things like shower chairs, handlebars, grab bars, as well as financial assistance as far as accessing other local, state, and government resources. So the ALS Association would be a great first step. And then an ALS clinic, for example, the Healy Center, which is the ALS clinic at MGB, Mass General Hospital in Boston, is sort of a multidisciplinary clinic where folks could sort of in one afternoon see a neurology ALS specialist, a pulmonologist, social work, nutritionist, physical therapy, occupational therapy, speech therapy, psychotherapy, and so on, sort of all under one multidisciplinary setting where a patient and their family would sort of stay in one room and all of the other medical providers would sort of rotate and then collaborate at the end of the session to come up with a comprehensive treatment plan. In Northampton, we are able to provide most of those resources on an outpatient or a home care basis. Again, it's a multidisciplinary, it's a team sport between numerous different types of therapists and the patients and their loved ones and caregivers. There are some medications that we can offer. Folks are often very eager and willing to start medications. Unfortunately, ALS is a universally fatal disease, again, with a median life expectancy around 3 years, but we have some oral medications that can help slow the disease a little bit, on the order of 10 to 20%. And we also have an IV medication. The oral medication for folks wondering is called Riluzole or Rilutec. That is an oral pill that people can take. And then the IV medication is called Endaverone. The trade name is Radicava. That is an IV medication. And oftentimes folks can use these medications simultaneously for some combination or synergistic effect. We're not entirely sure how these medications work. The theories are that they reduce some of the stress and oxidative damage that is going on with those motor nerve cells that control movement. And the idea is that it helps to sort of just slow down the degeneration of those nerve cells. There has been a ton of research, which we might come to shortly, but there are dozens of medications sort of in the pipeline. Unfortunately, we have just met numerous roadblocks as far as medications that show maybe initial promise, but then don't pan out in larger populations of patients. There's one medication that some folks in the listening area sort of might be grandfathered into staying on, called Relivio, Relivrio, and that was actually recently removed from the market. So they are grandfathering patients who are already on that drug are allowed to stay on it, but they're not having new patients start that drug, again, because in larger studies, it showed that it was not beneficial. So it's sort of back to the drawing board. And the ALS clinic at MGB at the Healy Center, they have actually been one of the primary sites in founding the platform trial, which is really sort of a revolutionary and landmark research trial where they're sort of reducing the cost of research by like 30%. They're decreasing trial time by over 50%, and they're simultaneously increasing patient participation by like 65%, the statistics from their website. In the platform trial, they're essentially testing multiple different drugs simultaneously. So rather than doing one drug, spend months or years seeing how that works with positive or negative results, they're sort of in parallel looking at multiple different options simultaneously, which is sort of a very unique way of doing things. And they're really at the forefront of ALS clinical research.
Where nationally is the most of the research coming from?
So I think our colleagues at MGB, Mass General Brigham, at the Healy Center in Boston, I think they are at the forefront. Some of the other big centers would be places like the Mayo Clinic, our colleagues down in North Carolina at Duke and UNC are doing a lot of work. So there's a lot of collaborative work going on nationally. And we are so lucky, and I'm so honored to be affiliated with our colleagues in Boston, Dr. Marikadowicz and Dr. Paganoni, who are really at the forefront of pioneering clinical ALS research.
So we're lucky in the fact that here in Western Massachusetts, we have the resource of Cooley Dickinson and Mass General Brigham in our backyard.
Absolutely.
How many ALS patients do you see in the course of a year?
So again, when it's affecting about 2 per 100,000, at Cooley we have a small handful, probably on the order of 3 to 5 patients per year. And so, yeah, we go from there. The Boston being a much larger urban center, they obviously pull quite a bit more. But in our community outpost here in Northampton, we're probably in the order of 3 to 5 patients per year. And they're often coming from either from my primary care colleagues, or I actually see a lot of patients coming from our ENT, ear, nose, and throat, especially if there's a swallowing sort of voice or swallowing issue. Our ENT colleagues will refer patients in.
And what other, you're a neurologist, what are the other diseases that you treat? Because people often wonder what a neurologist does.
Absolutely. So I think, believe it or not, the vast majority of my day-to-day clinic is actually treating patients with headaches, most of which are migraines or cluster headaches. But I also take care of patients who have epilepsy, epileptic seizures. I take care of patients who have been discharged from the hospital after having suffered a stroke as they're on their rehab process from stroke. And then I see a wide variety of other neuromuscular conditions, for example, peripheral neuropathy. The classic case is folks who have diabetes who might develop numbness or painful tingling in their hands and feet from nerve damage from diabetes. So I see a wide variety of patients in addition to ALS. But yeah, we are able to take care of a wide variety of neurological conditions at Cooley Dickinson here in Northampton.
What made you choose neurology as a specialty?
Great question. My go-to story for this, I suppose, was when I was sort of an undifferentiated third-year medical student at Brown. I was enjoying OBGYN, I was enjoying internal medicine, and then at the end of my third year, I did an emergency medicine rotation where you sort of are getting all sorts of acute emergencies. And for whatever reason, the confused patient, for example, who might be post-ictal after a seizure, I really enjoyed the puzzle of putting together, like, why was that? What was going on? Why was a patient confused or having a seizure, or what happened that someone is weak on the right side of their body and having trouble speaking? And we could correlate that anatomically with loss of blood flow and a stroke going on in their left hemisphere, controlling speech and the right side of their body. So I just found that really fascinating. And then I also got to actually rotate with a neuromuscular ALS specialist at Brown, who has since retired, Dr. George Sachs, one of my mentors, who actually headed the ALS clinic in Providence, Rhode Island. So I got to rotate there one Friday every month. They had 1 or 2 Friday ALS clinics there per month, depending upon who needed to be seen. So I got to rotate there and get firsthand experience and firsthand exposure to meeting patients with ALS at all different all different aspects of where they were in their journey, all different points of their journey. From folks who were newly diagnosed to folks who were, entering palliative care or hospice care towards the end of their journey, and everywhere in between. So,
are there any words of encouragement that you can offer somebody with recently diagnosed with ALS about research or new therapies or things like that at this point?
So I think that there is always research going on. Again, the platform trial and the research going on at MGB is really pioneering and propelling ALS research forward. So folks who are interested can get involved in a variety of different ways. It need not be just like clinical drug trials and medications that you would have to take by mouth or by IV, but they're also doing family history trials. They're able to, in some cases, offer genetic testing and trying to come up with biomarkers for predicting who may or may not get ALS or who may or may not progress at a certain rate. So there's a lot of opportunity between the ALS Association that can connect folks with clinical and other research protocols, as well as the Healy Center at Mass General Brigham in Boston.
Dr. J. Levin, thank you so much for sharing your insights this morning. I really appreciate you being here. We're going to take.
I appreciate you having me. Thank you.
Thank you. Dr. Levin's appearance has been made possible by Adam Bagney and Christina Trinchero at Mass General Brigham and Cooley Dickinson Hospital. We're going to take a break to acknowledge our underwriters, and we'll return more with this program. Peter Coles is our chief engineer. I'm Mark Auerbach. Don't go away.
Support for the community programming of WSKB is provided by the Dunkin' Donut Shops of Westfield and the Sardinia family. It's nice to know that even as the world changes, Dunkin' Coffee remains the same at 7 convenient locations throughout Westfield. Support for community radio on WSKB is provided by Betts Plumbing and Heating Supply Company, an independent, family-owned wholesaler serving Westfield for over 50 years, specializing in plumbing, heating, and industrial piping supplies. On the web at bettsplumbing.com or at 14 Coleman Avenue in Westfield.
Listen to me, Michael Buster McMahon, Mondays 8 to 10 a.m. to learn the stories behind your favorite songs. Or don't. I'm not the boss of you.
Community Radio 89.5 WSKB.
Live from Studio 120 at Westfield Technical Academy, this is WCPC Channel 15 and 89.5 FM WSKB Westfield.
Welcome back to On the Mark, everyone. I'm your host, Mark Auerbach. Peter Coles is our chief engineer. And this is part 2 of a program that we are dealing with, talking about ALS, or as you learned in the first half hour, Lou Gehrig's disease. My guest this half hour, first guest, is Amy Dryansky, and Amy is an arts administrator and a poet, and we've known each other for years. Her husband recently passed away after having ALS, and with her is Ron Hoffman, who is the executive director of a program called Compassionate Care ALS, which is a not-for-profit organization that provides programs and services for people living with ALS and their families and caregivers. And I want to welcome both of you to this program today. Amy, we haven't seen each other in a long time, and it's nice to reconnect.
Good to see you, Mark. Thanks for inviting me on.
And Ron, very nice to meet you.
Peter, good to see you. Amy, good to see you again, dear.
Yeah. As I announced at the beginning of the hour, there are 2 people that I wanted to dedicate today's program to. One is the Broadway actor Aaron Lazar, who was recently diagnosed with ALS and brought the Broadway community together to record a song called The Impossible Dream, which you can find on YouTube, and that's Broadway's response to ALS. And the other is a member of my family, Pam Graboff, who has been living with ALS since 2018. And I can speak firsthand that being a family member to somebody living with ALS can be a very tough situation. Amy, you lived this thing personally. Tell us a little bit about your husband and how you dealt as a caregiver with him being diagnosed with ALS.
Sure. Yeah. It's nice to be able to talk about John, and John is more than just John with ALS, right? John had a whole life before he was diagnosed in his late 50s, so he was young. And he was a very physically active person, mountain biker, skier, paddler, and a risk taker, someone who really enjoyed putting life and limb at risk, which did not always make me so happy. So I think, the diagnosis seemed in some ways especially cruel for someone who was just so invested in being outdoors and using his body in that way. So what would you like to know about caregiving? Because there's a lot of territory there.
There is a lot of territory, but once you all learned about the diagnosis, what if somebody else were to come to you and say, my spouse or my child or my parent was diagnosed with ALS, what would you want them to know about John's journey and yours that would help them be better prepared or better cope?
Thanks. Yeah, that's a great question. Well, first I would tell them to call Ron and at CCALS, because it made all the difference for us, and I that's not an exaggeration. We were in such shock, and the healthcare system in our country is just so difficult to navigate, right? And it's so hard to know what to do and how you can get help and how you're going to pay for help. And also, as not knowing much about what was coming with the disease, right? What would we need in order to keep John home as long as we could and comfortable in order to support our family. So we were lucky enough to have a friend who had met Ron and talked to us about CCALs and said we should be in touch. And CCALs really helped us from day one understand what we might need. They donated amazing equipment to us. John had this incredible chair toward the end that we got from them that really was a lifesaver. And just is just a group of incredibly caring people, dedicated and caring people. You don't feel like you're part of an institution. It feels like a family, and then you meet other families and other individuals who are undergoing this diagnosis and this disease. So the other thing I guess I would say is the Healy Clinic at Mass General in Boston is supposedly, I think, one of the best clinics in the country for ALS. And they were incredibly helpful to us. So I think, what I would say is don't be alone. Don't be alone in this. Reach out, find other people who've been through this and can help you. Involve your community, your friends, and any organizations you can find that'll give you support.
Yes, the first half hour, we had Dr. Jay Levin from Cooley Dickinson, who's a neurologist, and talked about the program at Mass General Brigham and said it's one of the best in the area, and it's in our backyard, essentially. So if anybody or their family is dealing with somebody with ALS, you don't have to drive to Boston as your first step, because Cooley Dickinson in Northampton is a partner of Mass General, and you can get a lot of your care there. I don't know if that happened for you, Amy, but for a lot of people with other diseases as well as ALS, Cooley Dickinson is a great first step.
Yeah, I don't think that I knew that at the time. So we did drive out to Boston, which was, not the most fabulous thing, but we figured it out.
And Ron, you have a nonprofit that helps people with ALS. Tell us a little bit about it.
Sure. First of all, I'm not only the executive director, I'm the founder of CCALS. And but before I do that, I just want to touch into, I want to speak about John for a second. John was one of the most conscious, awakened human beings I've ever met, which in itself made the ALS experience, the journey, if you will, a bit more easier, if I can use that word. Oftentimes, some people can become incredibly disconnected and shut down. You asked in the beginning, what would Amy share with someone who came to her that was recently diagnosed? In my opinion, anyone diagnosed with ALS automatically becomes incredibly traumatized, whether they know it or not. And I caution folks in regards to meeting other people, because their experience isn't theirs. Their way isn't theirs. ALS can look uniquely different. When I meet someone for the first time, what I told John, I am sure, and Amy, I'm not here to tell you what you don't want to know, because some people don't want to know anything. Fewer people want to know everything, and most are somewhere in the middle. So the art of language is incredibly, incredibly important in how we show up and tend to, which is what we do at Compassionate Care ALS. We tend to and care for individuals navigating all the complexities of living with ALS, which there are many, whether it's physical support, emotional support, or spiritual support. Our model is uniquely different. It's very much a relational model. I've been doing this work since 1997 when I was a caregiver for a gentleman. That's what started all of this. About a month before Gordon passed away, I sat with him and his wife, Betsy, with the idea of putting a fund together in their name. And they said yes to it. And we created the Gordon T. Heald ALS Fund. And within 2 or 3 years, that grew into and birthed the nonprofit that we are today, Compassionate Care ALS. We work with families all over Massachusetts, all over New England, New York, Connecticut, actually all 50 states across the US and many countries around the world. So I'm comfortable in saying we've been leading the way in care for the ALS community since 1998.
And what kind of, if somebody wants your help, Ron, will they, first of all, give us the website that people can go to learn more about the organization?
Yeah, the website is ccals.org, Charlie, Apple, Larry, Sam.org. There's incredible information there. What I counsel people to do is take what serves, let go of the rest. You know, when someone is just diagnosed, sometimes information can be really hard to see. People go online, they see that, quote, it's a fatal illness, life expectancy, now they say 3 to 5 years. But you can see some very difficult circumstances that many people aren't ready to navigate, to explore. And so, you know, I'm always share with folks, be cautious. You know, take what serves, let go of the rest. And I remind them all of this can be uniquely different from one person to the next. I'm really big on stories and about what's possible, you know, and it's really, really important. And our work's about walking alongside folks as much or as little as they wish. And that was the beautiful thing about Amy and John. They knew we were there. I could get a text or Michael, one of my colleagues, one of our staff, they would reach out to Michael, what's possible here? Or there's a new challenge. How do we navigate this? So it's all about how do we learn to live life differently? So,
Ron, how many people do you have on your team that can go out and be caregivers and support?
Well, we now have a staff of 29. And we are not that small anymore. And, you know, I have senior care liaisons, I have care liaisons, I have individuals picking up, delivering equipment. We have a huge warehouse. We have offices in Falmouth, downtown Falmouth. We have an incredible retreat center that we built some years ago here in Falmouth. It's the Healed Center where individuals living with ALS can come and stay, couples or caregivers can come and stay for respite. We don't do hands-on care, but it's a one of a kind. It's the only place like it in the United States. We've literally had individuals with ALS and caregivers travel here from all over the country. So our model is unique in what we're able to offer and what we're able to bring to individuals and their families. Our program is extensive.
And what do you charge for these services? Is it donations and corporate sponsorships and support that pays for this, or the patient's insurance?
Yeah, we do not charge for you know, the work that we do, the equipment that we give away. The only time we ever charge if someone needed a ramp system or a vertical lift, which is really expensive. If folks are able to, and oftentimes we'll do rentals, or oftentimes we have some of that material. If they can assist with installation, that's great. If not, we take care of it. That's the only time. And
okay,
the durable medical equipment we give away.
Yeah, I mean, just to say, we would not have been able to keep John at home had it not been for some of the equipment that we were able to get from CCAL. So we were able to install a ramp with their help. We were able to install a stair lift, you know, stuff like that, that I didn't even, you know, I couldn't even have approached that. But also just, I wanted to touch on something that Ron said about sharing and not sharing, because I think he's absolutely right. I think part of what happens as a caregiver is that there's this outpouring from people when they know that you have a partner or someone with diagnosis, maybe a relative, whatever, sister, mom, dad. And some of what you get is not what you want. And it's not because people don't care, you know, it's just that You don't know possibly what you want until you know what you don't want, right? Sometimes it's too much. Sometimes you don't want to hear someone else's horror stories. Sometimes you don't want to hear, thoughts and prayers. So you do have to be careful, I think, about how you share and who you share with. On the other hand, we had an incredible group of friends who helped us and supported us throughout this process. And I think that I was reluctant at first to share as much as I did and ask as much as I did. But in the end, it was such a beautiful experience for us to have this group of friends who were so directly involved with John's care, who loved us, who loved John. And I could not have done it without them.
Yeah, I can really understand that from the experience that I've had with a family member, with Pam, and the people who have come forward. Pam was a high-powered hospitality industry executive when she was diagnosed, and she traveled all over the globe for her job. And people from all over the globe have been supporting her and bringing her all kinds of help. And when she was diagnosed, she turned her attention to raising money for ALS Georgia because she lives in Atlanta. And every year they have a fundraiser called it's a parade of sorts. And so she started Pam's Parade. And from individuals and small businesses has raised over $50,000 each year that she's been involved to provide for caregiving for people with ALS in Georgia. So she turned her high power executive duties into a very positive way to live with the disease in helping in that way. And I personally think she's heroic for doing that. And I know so many people that face any kind of catastrophic illness that go inward rather than outward. We need to take a quick break to acknowledge our underwriters that make programming here possible. We'll be back to talk with Amy Dryansky and Ron Hoffman, so don't go away. Peter Coles is our chief engineer. You're listening to or watching On the Mark.
Underwriting for the community programming of WSKB is provided by the Boys and Girls Club of Greater Westfield, serving the youth of the Whip City and surrounding communities since 1969. For more information on the Great Futures Club for ages 3 to 5, happening weekdays, and the Club Teen Center for ages 11 and older, weekdays from 6:30 till 8 p.m., go online at bcgwestfield.org or visit the club at 28 West Silver Street. The Boys and Girls Club of Greater Westfield. Great futures start here.
Support for community radio on WSKB is provided by Betts Plumbing and Heating Supply Company, an independent, family-owned wholesaler serving Westfield for over 50 years, specializing in plumbing, heating, and industrial piping supplies. On the web at bettsplumbing.com or at 14 Coleman Avenue in Westfield.
Join us every Thursday morning
from 6 until at least 7:30.
Check out the Bobby G and Company Show
right here on WSKB 89.5
Community Radio 89.5 WSKB.
Live from Studio 120 at Westfield Technical Academy, this is WCPC Channel 15 and 89.5 FM WSKB Westfield.
Welcome back to this special On the Mark and Survivor Story program about ALS, or as it's often called, Lou Gehrig's disease, with Ron Hoffman, who's got a nonprofit based in Falmouth, Massachusetts, that serves the state, providing programs and services for people living with ALS and their families. And Amy Dryansky, who's an arts administrator and a poet based here in the Pioneer Valley, and she was a caregiver. Her husband recently passed from ALS. I'm going to ask you first, Amy, in addition to Ron's program, were there any local support programs up and down the valley that you turned to for immediate needs?
Sure, yeah. I would say for one thing, the Visiting Nurse Association had just an incredible group of people who would come out. They can't do kind of long-term kind of care, but they certainly can provide certain kinds of services. For us, that was very important. They can do assessments. They can, at times when I was worried about, John's breathing, for example, they could come and do an assessment and reassure me or let me know if they thought that he had moved, onto a different phase. Just an incredibly dedicated and caring group of people. Like I just was astounded by the level of support and care I received from them. I also got assisted, John's and Ron, Phil, correct me if I'm explaining this incorrectly, but ALS is a diagnosis in Massachusetts that automatically qualifies you for certain kinds of support and services from the state. So we actually were able to help pay for some of our in-home caregiving through the state program. And it was at first pretty daunting and difficult to navigate, but once you figure it out, and I did get some help from CCALS and from some other folks, it's not terrible. And it does help defray the costs of caregivers in the home. And there's also an agency in Greenfield, and I feel terrible because I'm forgetting their name. The Elder Care Group in Greenfield. It's a county-wide agency, and they were also able to help me navigate some of the systems that I needed to navigate for John. So in the end, I would say the one of the absolute most important agencies we worked with was the Fisher Home in Amherst, which is a hospice. It's a nonprofit hospice, and that's where we eventually ended up when I could not care for John at home safely. And they were just outstanding. I can't say enough about the care that they gave John. And again, just a group of people who you never felt like you were in an institution. You felt like you were with a group of people who genuinely cared and they loved John and who were dedicated to helping John and our whole family, because I do have two children who lost their dad. John passed, by the way, in January this past year. But just helping us spiritually in every way that they could.
Amy, how do you manage as a caregiver? How did you manage to concentrate without it debilitating you?
I'm not sure that it did not debilitate me. I have to be honest about that. I mean, I was working at the same time that I was helping to care for John. So I have to be honest, I would be upstairs. I work from home. I work primarily remotely. And actually, Mark, at this point, I'm working for a land conservation organization in Berkshire County. I'm not working in the arts, although I am still a poet. But I would be at my desk upstairs doing my remote work, and then I would be running downstairs to where we had made a room for John that he could navigate to his desk when he could still do that between his bathroom and desk, and I would be hooking him up to getting his nutrition, because at that point, for example, he was using a feeding tube. And then I would be going back upstairs and doing my work and then coming back down and checking on him. I would be helping the caregivers, I would be preparing food when he was still eating. And then also when John was ill, it was also the height of COVID. And that was tremendously challenging because, we had to desperately make sure that John did not get COVID. And as it happened, I and my eldest both got COVID while John was still in the home, and I was isolating upstairs in my bedroom. So it was tremendously difficult. I can't gloss that. It was tremendously difficult. And I think it's only now that looking back on the 3.5 years when I was caring for John, that I realized how hard it was. And it's it's traumatic. As Ron said, it really is traumatic. And I think it's going to take some time for me to process what we went through and also my kids, especially my eldest, who was home and actually physically helped care for John in a very intimate way. I think it's going to take us a while to process that.
Yeah. My sympathy and my heart and compassion go to you, but also I salute you for the strength that you have to keep going. I don't know how I would react in the same situation.
You don't know until you have to do it.
Exactly. Yeah. Ron,
go ahead.
We only have a minute or so left. What would you advise a caregiver or a family member of somebody living with ALS to help them, A, maintain their composure when required, and B, to maintain their strength so they don't fall apart in caregiving?
So our work is as much for the caregiver as it is for the individual living with ALS, having been a caregiver. First of all, what I know is every caregiver doesn't have the capacity to continually show up 24/7. I don't know a caregiver living with ALS that can do it alone. I've not met one. And so that's why our work is as much for the individual doing the tending to and caring for. Anyone living with ALS, I would counsel them to reach out to us. Because again, I know no one that can do this alone. It is beyond anyone's understanding of what it is to be tending to and caring for someone living with ALS. It's pretty extraordinary. And for friends and community, my counsel to you would just be show up and just hold space, if you will. Oftentimes, a lot of folks, what can I do? What can I do? What can I do? And respectfully, what that does, it puts something on maybe Amy and John's plate that they had to think about early on for their friends and community to have to do. And what I will say is they had an incredible community, a very awakened and conscious community. And of course, Amy and John led the way in that. So everyone isn't as fortunate to have that type of support. So
I want to thank both of you for being here today. I know it's a difficult topic to talk about, particularly for you, Amy. But I think it's important for people to know about ALS, and that's why we devoted this program to it today, but also that there are resources available, not only to people living with ALS, but to their families and their caregivers. So I want to thank both of you for being here. And we've been talking with Ron Hoffman and from Compassionate Care ALS, and with Amy Dryansky, whose husband recently passed from ALS, and Amy, who is an administrator and a poet here in Western Massachusetts, was her husband John's caregiver. Thanks to both of you. Peter Coles is our chief engineer today. I'm Mark Auerbach, and we'll see you next week with another edition of On the Mark.
I'll get out of my little room. I'll get out of my tight and tiny little room. I'll get out in the open air, meet the gang and meet myself out there. Start connecting with the world out there. Now's the time, now's the time. I'll go walking on down the road, join the talking and squawking, walking down the road. Want to be in that happy place where the faces look like one big face. That's the place I want to see my face. Now's the time, now's the time. No more singing for myself, no more going it myself and all alone. Gotta sing for everyone's supper, not just my own. out of my little room. Say goodbye to my tight and tiny little room. Say hello to the